And welcome back to the show. Medicare is an important health asset for many seniors and others who are requiring assistance with health insurance in the United States. Now, Healthfirst is committed to providing Medicare enrollment assistance in any way that it possibly can. Joining us now and sharing more details, we're pleased to have the Senior Vice President of Medicare at Healthfirst, Jen Cohen-Smith. And Jen, good to have you with us.
It is great to be here. Thank you, Daren.
Important conversation to have. And, when it comes to Medicare, a lot of conversation and sometimes a lot of misunderstanding. So just want to be able to walk our viewers through a little bit and share a little bit about Medicare. So I'll begin first with who is actually eligible for Medicare?
Yeah, it's a good question. Generally, anyone over the age of 65 years old is eligible for Medicare. Also, some younger people with disabilities and people with end-stage renal disease are eligible. But broadly, it's a over 65 population, and there's over 200,000 of those folks here in the Bronx.
Wow. And so when we talk about Medicare, having it is important. And also for someone who wants to get it, they always ask the question about cost. What is the cost association with Medicare?
Yeah, Medicare Advantage can be offered and is generally offered in the Bronx at zero premium. So meaning you don't have to pay anything extra to have Medicare Advantage. With that said, there could be co-pays and cost shares that you'd want to make sure you understand and take into account. But generally, getting the Medicare Advantage coverage would cost you nothing extra.
Mm-hmm. And for a person who decides that I want to enroll, is there a particular time period that they have to be able to get into Medicare?
Daren, I'm glad you asked because it's the annual election period and it starts on October 15th, just a few days away, and it runs until December 7th, so October 15th to December 7th every year. And this is the time for folks to either enroll in a Medicare Advantage plan, to switch Medicare Advantage plans, or to drop out of a Medicare Advantage plan should they want to for any reason. If, though, you're turning 65 at some point out of that October to December window, you'll have 3 months before your 65th birthday and 3 months after your 65th birthday to enroll in Medicare Advantage for the first time.
We hear so much, from government, and we follow it right here on the show about cuts to Medicare, changes involving Medicare. So as we're in this new year, well, getting close to the end of this year, actually, last quarter, talk to us about what we can talk about with regards to 2021 and any changes and things that people need to be made aware of.
Yeah, it's a good question. And to a large degree, any changes to the benefits from 2021 to 2022 will depend on which insurance carrier you have Medicare Advantage through. So everyone who has Medicare Advantage today should have received in the mail what's called an annual notice of change letter. And that letter will describe in detail for you any benefit changes that you would be experiencing should you stay with that plan on January 1st of 2022. More broadly in the market, though, there are some exciting changes happening in Medicare Advantage that you might want to take into account when you are considering whether or not to change plans or stay with your plan. For example, the over-the-counter card, the OTC card it's oftentimes called, is being offered in new and expanded ways. You can, at Healthfirst, for example, you can internet services in your house. We learned that 30% of seniors don't have internet today, and we really wanted to make that more accessible to folks because it's so important for accessibility of care and staying connected to your friends and family. There are also, enhanced benefits broadly out in the market around dental care and vision care and other ways that you can use your over-the-counter card, like for exercise equipment, for example.
And so when you have Medicare, I think a lot of people wonder, what are actually the benefits? What's actually covered under Medicare? Because having it is important, but also knowing what you have as a part of it is equally more important.
Yes, and that's a really good point. If you are covered under Original Medicare, which is Medicare Parts A and B, many services are covered, like inpatient hospital services, services in a skilled nursing facility, hospice care, some doctor's services, some outpatient services, for example, some medical supplies. So many, but not all of your Medicare or your healthcare coverage needs are covered under Original Medicare. When you move into a Medicare Advantage plan, on the other hand, you will, for the most part, have additional benefits available to you. Things like dental coverage, vision coverage, hearing aids and hearing tests. Again, the over-the-counter card that could make all kinds of things accessible to you, the internet, health and fitness equipment, healthy foods. You may even be able to use the card at a farmer's market, for example. So you can really get a nice suite of additional benefits by signing up for a Medicare Advantage plan that aren't otherwise available to you through original Medicare.
Yeah, and when you have persons who are using Medicare, obviously they know their benefits, and sometimes it's hard not to, well, it's hard not to, or let me rephrase again. When you have a person that has Medicare, they have their benefits, but sometimes it's hard to basically keep up and to follow exactly what's going on, the changes that are happening, the new things. So how does a person, considering mostly of them are 65 and up, how can a person really stay up to date and connected with the rapid changes and the benefits and all that Medicare has to offer?
Yeah, there are a lot of great resources out there. Healthfirst has a website, hfmedicarelearnmore.com. And on this website, there are various videos. There's a Medicare education booklet you can download. Those two things will just teach you broadly about all things about Medicare. What's changing? What do you need to know? How do you sign up? Also within that website are guides and tools to help you determine which healthcare benefit package is best for you and your health needs. Another great way to keep in touch is to stop into the community office. We happen to have one on East Fordham Road, 25 East Fordham Road in Morris Heights. And you can ask any questions you have there, you know, make some friends and keep in touch with what's going on. And also, if you can download the mobile app, there's a member app that most Medicare Advantage plans will offer that will help keep you up to date on your benefits and how your services are being used.
Well, Jen, been very informative. Certainly, I think people have gotten a little bit more acclimated with Medicare. And of course, our job is to get people connected with more information. And so we'll be able to do that in just a few seconds. But thank you so much for being with us here on the show.
Thank you. It's my pleasure.
Yeah, I want to let our viewers know also that if you want more information, what we can encourage you to do is visit the website. And the website is healthfirst.org. And then you can also follow them on social media at Healthfirst NY. We are taking a quick break, and we thank Jen for joining us. But guess what? We are not out of show. Stay with us. Open will continue coming up right after this.